It's an organisation that brings people together.
And the thing that joins us is that we all believe that people should have access to psychological and social approaches if they experience something we might call psychosis.
We stress the importance of psychotherapy, psychosocial treatments to psychosis.
I definitely feel like it's an important organization because we really need each other, nationally and internationally.
And it also creates an opportunity for conversation.
I feel grateful to have met so many people thinking in the same manner.
Valuing the person, embracing diversity, social inclusion, about doing whatever we can to ensure that service users and families get the best possible outcomes.
ISPS core values have developed over the years. For many decades, the primary function was improving access to psychological therapies. And in the last, I would say, 10 years, we've expanded out a bit to focus more on the psychosocial causes.
The core ideas of the ISPS is to give human relation back to these persons. And can we give treatment and care which does not make them void of relations, so to say, then we give them the chance of coming back again.
ISPS originated in the mid-50s. There was two founding members, Muller and Gaetano Benedetti from Italy and Switzerland. The first conference was in Lausanne in Switzerland in 1956, I think it was. For the first 30 years or so, it centered around organizing conferences around the world. And for the last 20 years, it has been an organization with a board and everything that goes with it. In the 50s, there was a growing understanding that it was important to look upon people with psychosis as human beings not very different from other human beings. One of the central members said it's much more human than otherwise.
My relationship with ISPS started in the 1980s. We were a group psychiatrists from Sweden. We met the giants at those days, Benedetti, Ciompi. At that time it was very much psychoanalytic to the theoretical frames. Now it's more eclectic, but more humanistic, so to say.
ISPS kind of grew as an organisation for sort of psychodynamic psychotherapists who were being massively revolutionary by even daring to speak with those of us who are diagnosed with a form of psychosis. So they were like groundbreaking. But as it's come into the 21st century, it's met the survivor movement. People like me who kind of aren't content with kind of just sharing our experiences of therapy, but actually have ideas about what needs to change in therapy. And so we've come to be part of the organisation alongside family members to really start to push it forward, to challenge existing ideas. It has the potential to be a revolutionary organisation because it isn't an activist organisation, it isn't a mainstream organisation, it's a giant umbrella that brings together people from different orientations, different backgrounds, people that don't agree with each other a lot of the time, and it creates a space where we can try and listen.
My first ISPS conference in New Zealand, it was just such an amazing, inspiring experience to be there. I couldn't believe that there were these other like-minded people that had the same ideas that I did about wanting to create change and really trying to understand how we could be working more effectively with people with psychosis.
And it's always really valuable being able to exchange ideas and views.
ISPS has been a vehicle for me to sort out options that I didn't find in my community at home.
To be at a place like this with 600 people from 44 countries, all in our different ways pushing towards the same thing and pushing against the same thing, it's just awe-inspiring to me. And there isn't anything like it in the whole of mental health. There's some good professional groups, there's some good service user groups, but an international organisation that makes room for everybody, including family members, and finds a way to tolerate all the stresses that brings with it is quite unique, I think.
We have, I guess, more than now 20 countries that have their own ISPS organisation.
So I'm on the international executive, and I suppose essentially I see my role there is, first and foremost, it's always to represent service users, because I don't have, that's what I do naturally, it's inherent to do that. But I see also as a committee member that it's actually to facilitate the local groups and ensure that they have an easy run and the opportunity to expand, because it's all about spreading the word.
We also have like a journal where people can write up scientific work.
At the moment I'm the editor of the journal of the organisation, a journal called Psychosis. It has all the traditional type research, qualitative, quantitative, lots of big number research, but also what makes it unique is two things. It refuses to take a penny of drug company money, which is actually quite relatively rare in the world of mental health. Perhaps more importantly, we always have at least one first-person account in every edition. Usually first-person accounts of people who have been through psychosis, so we try and bring it a bit to life by having human beings in the journal as well as lots of numbers.
My hope is that ISPS can become to be more relevant for people. I still think so many people don't know what's available to them. So many practitioners dare not talk about voices or unusual beliefs, chaotic thinking, stuff like that. And my hope is that we can continue to get the word out there.